Welcome to This Explainer. Today, I am absolutely thrilled to dive into a topic that honestly touches almost all of us, yet it's driven by these completely invisible economic forces that we rarely see. We're going to unpack the anatomy of a crisis playing out right in our own neighborhoods, the vanishing of our local pharmacies, and ultimately, the path forward for the whole industry.
Take a look at this number, 40 million. Think about that for a second. That staggering number represents the amount of Americans currently living in what researchers are calling pharmacy deserts. We're talking about millions of households suddenly finding themselves without practical access to life-saving medications, basic health screenings, and just the trusted advice of a local professional.
Okay, let's dive into this. Why exactly are our local pharmacies vanishing at such an alarming rate? Well, it's a giant puzzle, really. It involves this crazy mix of corporate consolidation, invisible middlemen, and rapidly shifting economic tides.
But, before we can actually point fingers and identify the culprits behind this mystery, we first need to understand the devastating scale of the crisis. So let's look at Section 1, the rise of pharmacy deserts. Now, a pharmacy desert isn't just some minor inconvenience. It's not, having to drive an extra 5 minutes to grab some shampoo. It means a community is severely lacking practical access to a pharmacy, and that significantly worsens health outcomes and medication adherence. For folks who are elderly, immobile, or very ill, a pharmacy that's just a few miles away might as well be on the moon if they don't have reliable transportation. This is a very real barrier to life-saving medication.
Just to put a human face on this data, listen to this stark reality from Greenfield, North Carolina. For the residents of Greenfield, Shopko's decision meant they had to scramble. Shopko had sold the pharmacy records to a Walgreens 50 miles away. I mean, wow. Imagine depending on a daily medication for a chronic condition, and suddenly picking up your prescription transforms from a quick errand into a massive half-day road trip.
The cascading statistics here are, frankly, pretty alarming. Since the year 2000, we've seen roughly 18,000 pharmacy closures. That has literally left 630 rural communities without a single drugstore. And the really tough part? This doesn't hit everyone equally. The impact falls heaviest on our most vulnerable communities, disproportionately affecting rural towns, low-income areas, and non-white neighborhoods.
So who or what is actually causing all of this? It's time to play a little economic whodunit. Let's move to Section 2, squeezing the independent pharmacies, and look at the invisible forces driving these closures.
A massive piece of this puzzle is the PBM. Pharmacy benefit managers, or PBMs, are essentially the intermediary middlemen of the healthcare system. They negotiate between drug manufacturers and health insurance plans, and crucially, they completely control drug pricing and dictate exactly how much pharmacies are reimbursed. It's absolutely crucial to understand their behind-the-scenes role in the drug distribution chain.
But here is where the plot really thickens. Look at that massive 85% slice on the chart. Just 3 giant PBM companies control 85% of the entire market. The remaining 15% is basically left for everyone else combined. When just 3 middlemen have that kind of highly consolidated market power, they hold an incredible amount of leverage over local, independent pharmacies.
Now, what's really interesting about this slide is exactly how they use that leverage. PBMs systematically squeeze independent pharmacies using 3 specific tactics. First, low reimbursement rates, often literally paying pharmacies less than it actually costs them to buy the drug. Second, retroactive clawbacks, where PBMs demand money back weeks or months after a prescription is already filled. And third, predatory audits that can result in massive, arbitrary fines. Put it all together, and it's nearly impossible to stay in business.
But hey, this crisis has escalated way beyond just the mom-and-pop stores now. Section 3, the retail pharmacy exodus. We are currently witnessing a massive structural collapse within the major retail chains themselves.
The sheer scale of this retail exodus is breathtaking. Just look at these corporate failures. Walgreens is slated to close 1,200 stores by 2027. CVS is closing 270 locations in 2025. And Rite Aid? They filed for bankruptcy twice in just 2 years. The biggest category leaders are literally boarding up their windows nationwide.
So why are the giants falling? Well, it comes down to a trifecta of market forces compounding the issue. First, that exact same PBM reimbursement pressure we just talked about is squeezing the big chains too. Second, there's a massive shift toward mail-order options and digital players like Amazon Pharmacy. And third, general macroeconomic pressures. With inflation and reduced consumer spending, people are just buying a lot less toothpaste and overpriced seasonal candy when they come in for their pills.
Okay, the situation sounds dire, for sure.
But lawmakers are attempting to intervene. Let's shift to the solutions in Section 4, the 2026 PBM Reform Law. The federal government recently stepped in to rescue the system.
On February 3, 2026, H.R. 7148, the Consolidated Appropriations Act, was officially signed into law. This targets PBM transparency and Medicare reforms. It's a bipartisan effort with a clear goal: to increase market transparency and basically check the power of these middlemen to create a more level playing field for pharmacies of all sizes.
And this brilliantly illustrates how these legal rescues are going to roll out chronologically over the next few years. The bill was signed in 2026. By 2028, Medicare Part D remuneration to PBMs gets strictly limited to flat, bona fide service fees, cutting out those murky rebate-linked compensation structures. Then, by 2029, any willing pharmacy protections begin, meaning PBMs can't arbitrarily lock local pharmacies out of insurance networks.
The law also bakes in some really vital ongoing protections. It requires semi-annual reports on net drug spending to stop spread pricing. Crucially, it establishes a formal, safe pathway for pharmacies to report PBM contract violations with a strict ban on retaliation. Plus, it creates special network protections for essential retail pharmacies in vulnerable areas, making sure underserved communities keep their lifelines.
But legislation alone isn't going to be enough. The pharmacy business model itself has to evolve technologically to survive. That brings us to our final solution, Section 5, the clinical care pivot.
The reality is, even with PBM reform, just dispensing pills isn't financially viable anymore. Survival requires pharmacies to adopt specialized medical billing technology. This software is exactly what enables them to offer higher-margin, pharmacist-led clinical services. It unlocks their true value, transforming them from mere dispensaries into comprehensive community health hubs.
So the crucial point is the stark financial contrast between the old way of doing things and this new model. Under the traditional dispensing model, a pharmacist might see a meager $2 reimbursement just for filling a pill bottle. But under a clinical care model, supported by expanded state laws like in Colorado, a pharmacist can be reimbursed up to $200 for an 8-minute clinical counseling session with a Medicare patient. That is an absolute game changer for revenue.
Why does this clinical pivot actually matter to you and me? Because everybody wins. When pharmacists operate at the top of their licenses, you get treated faster, right in your own neighborhood. Insurance payers save money by using a lower-cost care setting, and it completely relieves the strain on our overextended primary care doctors. This evolution directly protects your personal health and the well-being of your entire community.
The landscape of our healthcare system is shifting right beneath our feet. We've got powerful market forces threatening our local care, countered by sweeping federal reforms and a massive technological evolution. Which brings us to our final vital question. Will these new legal reforms and clinical pivots arrive in time to save your neighborhood pharmacy? Keep your eyes on this space because the future of your local healthcare access depends on it. Thanks so much for joining me on this explainer, and keep asking the big questions.